If you're over 40 and thinking about having a baby, it's completely natural to wonder, is it too late? The problem is that there isn't a universal answer. Pregnancy after 40 is absolutely possible. That's a medical fact supported by research and clinical data. But what that fact means for you is much harder to answer. To answer that question accurately, we would need to know much more about your individual situation. We don't know your exact age, your overall health, whether you've been pregnant before, the condition of your reproductive system, or what medical evaluations you've already had. Without that information, it simply isn't possible to answer the question, is it too late? This video isn't about giving a one-size-fits-all answer. Instead, we'll look at several key facts that can help you view pregnancy after 40 more objectively. What does this age really mean from a medical perspective? What challenges are actually associated with it? Which factors have the greatest impact on your chances of pregnancy? And why does the word late mean very different things in different situations? Our goal is to give you information that will help you better understand your own situation and have a more informed conversation with your doctor about what it means in your specific case. Being over 40 doesn't mean it's too late. From a medical perspective, being over the age of 40 does not mean that natural pregnancy becomes impossible. Yes, the chances of conception do decline with age. On average, women between the ages of 40 and 44 have about a 5% chance of becoming pregnant during a single menstrual cycle. But that figure does not mean there's only a 5% chance of pregnancy overall. With regular attempts, about 28% to 30% of women become pregnant within the first 6 months, and more than half conceive within a year. Age alone does not answer the question of whether it's too late. What it does tell us is that pregnancy becomes less likely than it is at younger ages, and that planning becomes more important. If you'd like to better understand what these numbers actually mean, how they should be interpreted, and why the chance of pregnancy in a single cycle is very different from the overall chance of pregnancy over time, we've covered that in detail in a separate video. No one can guarantee the outcome. Even though pregnancy after 40 is entirely possible, that doesn't mean it will definitely happen. In reproductive medicine, no one can honestly guarantee a pregnancy, whether you're trying to conceive naturally or using assisted reproductive technologies. The reason is simple. Pregnancy is the result of a complex biological process influenced by many different factors at the same time. That's why doctors talk about chances and probabilities, not guarantees. The goal of modern reproductive medicine is not to promise pregnancy at any cost. The goal is to maximize the likelihood of pregnancy while choosing the strategy that is most appropriate for your individual situation. Age is an important factor, but far from the only one. When people talk about pregnancy after 40, age usually becomes the main focus, and that's completely understandable. As women get older, the reproductive system naturally changes in ways that reduce the chances of conception. But age is only one of many factors. In reality, the chances of pregnancy are influenced by a whole combination of factors, including the condition of the reproductive system, ovarian reserve, whether ovulation is occurring, underlying medical conditions, lifestyle, the reproductive health of the male partner, previous pregnancies, and many other individual circumstances. Two women of the same age can have very different chances of conceiving naturally. As a result, the medical recommendations and the most appropriate strategy may also be very different. Age helps us understand the overall trend, but it never tells the whole story. The complete picture is far more complex. After 40, time becomes an especially valuable resource. The question, is it too late, doesn't always help you make the right decision. A much more useful question is, which strategy is most likely to give me the best chance of becoming pregnant? That's where time becomes especially important. After 40, the reproductive system continues to change naturally. The chances of pregnancy gradually decline, not overnight, not all at once, but steadily over time. That doesn't mean you should rush into treatment at any cost. Instead, the goal is to determine which approach is the most appropriate for your individual situation. For some women, continuing to try to conceive naturally is the best strategy. For others, seeing a fertility specialist sooner and considering assisted reproductive technologies may be the more appropriate approach. There is no universal answer. But if you've already decided that you want to have a child, there's usually little to gain from delaying the search for the strategy that best fits your situation. The goal isn't to find the perfect solution, it's to choose the one that offers you the best possible chance of pregnancy. Your partner's age and health matter. Planning a pregnancy is always about two people. When pregnancy after 40 is discussed, most of the attention naturally focuses on the woman. That's understandable because a woman's age has a greater impact on the chances of natural conception, the course of pregnancy, and certain pregnancy-related risks. But that doesn't mean your partner's age and health are unimportant. Male factors can also influence the chances of pregnancy. That's why the best approach when planning a pregnancy is to evaluate both partners. Don't assume that the answer lies only in your own age or health. This isn't just good medical practice, it's also the most practical approach. If the main issue is related to the male partner, focusing only on the woman can waste valuable time. And that means delaying the strategy that is most likely to help you achieve a pregnancy. Modern reproductive medicine views a couple as a single unit. The more complete the clinical picture, the greater the chance of choosing the strategy that is most likely to help you achieve the outcome you're hoping for. Don't overlook professional medical advice. When you're thinking about pregnancy after 40, it's completely understandable to want to figure everything out on your own. Today, there's no shortage of information, articles, online forums, personal stories, and advice on social media. The problem isn't a lack of information. The real challenge is knowing which information actually matters and which parts apply to your individual situation. Pregnancy after 40 isn't a question with a single correct answer. It requires considering many factors at the same time, interpreting medical findings correctly, and adjusting the strategy when necessary. That's why professional medical advice is about much more than simply getting another opinion. It's about choosing the most appropriate strategy and avoiding the loss of valuable time on decisions that may never have been the most effective approach in the first place. And perhaps most importantly, a good fertility specialist doesn't look for a universal solution. They help you find the approach that offers the best possible chance of pregnancy in your individual situation. Too late isn't always a medical question. When we ask, is it too late to have a baby after 40? We're usually thinking about health and the chances of pregnancy. But in reality, the word late isn't always about medicine. For some people, it's really a question of emotional readiness for parenthood. For others, it's about relationships, career, financial stability, or personal circumstances. These are all important questions, but they aren't questions that blood tests or medical evaluations can answer. They have much more to do with personal values, life goals, and individual priorities than with medicine. That's why we deliberately haven't tried to answer them in this video. Today, we focused only on the medical side of the question. We'll return to the psychological, social, and personal aspects of planning a pregnancy in future videos. Pregnancy after 40 is a topic that rarely has simple answers. We haven't tried to offer universal advice or ready-made solutions. Our goal has been different, to explain the key factors that are genuinely worth considering. What those factors mean in your own situation is something that can only be understood in the context of your health, your circumstances, and your goals.